Okay, so let's bring in my guest to discuss this ruling from the judge. Dr. Cohen, I want to start with you. What do you think about Crumbley being tried as an adult and also put in adult custody as he awaits that trial? I want to get your perspective as a psychiatrist in terms of what this effect this can have on a child, despite he's charged with horrific crimes. What effect could this adult custody have on a child of his age?
That's always the dilemma with adolescence. So the adolescent brain is somewhere between the brain of a child and an adult. And there's a lot of neuroscience research on this and even Supreme Court rulings on this in terms of, it being unconstitutional to give the death penalty to someone who committed the crime under the age of 18. The Supreme Court explicitly cited research data presented to them showing that the adolescent brain is not fully developed. But the other thing is that adolescents develop at different rates. So you can have an adolescent who is almost like an adult in a lot of their reasoning capability and emotional capabilities, whereas you could have an adolescent who's much more childlike. So in that regard, adolescents are really a moving target, and that's the difficulty with them. So, a person like this, you take a young person and you put them in an adult facility. The concern, of course, is that because they are not fully fledged adults, they're going to be exposed to a lot more stress in an adult environment, and they're not going to have the coping mechanisms for dealing with it. An additional concern is that one purpose of our criminal justice system is to reform the individual, not just to punish the individual. And so particularly for adolescents, you want to put them in an environment where they're more likely to be able to be reformed. So, for example, we were hearing that in the environment that's not adult in the Oakland correctional system, he would have access to 7 hours of schooling, whereas in the jail, he has access to books, but he's not really in school. So these are the types of things that you really want to think about. Of course, would also concern about security and safety. Is he a target in any way? And what kind of mental health care does he have access to when he's in that facility? So I think it makes a lot of sense to have someone come in on a monthly basis and really take a 360 look at what is their condition in custody when they're an adolescent.